Dr. Esra Uzer, and I'm Dr. Zeynep Balat. I will be really happy to introduce you. And Professor Dr. Esra Uzer is coming from Turkey. Dr. Uzer graduated from Faculty of Dentistry, Ankara University in 2001. She received a PhD degree in restorative dentistry from Ege University in 2007. She has a diverse experience in dental education by giving many theoretical and practical courses in Süleyman Demirel University and İzmir Katip Çelebi University. She received the Associate Professor title in 2012 and Professor title in 2018. She served in various administrative positions at different universities, including Vice Dean of Faculty of Dentistry, Head of the Department of Restorative Dentistry, Erasmus Coordinator, and Farabi Coordinator. Her research interests include aesthetic dentistry, composite restorations, caries risk assessment, adhesion, clinical trials, and digital dentistry. She has authored or co-authored many publications and has given many presentations at national or international specific meetings. She is a member of International Association for Dental Research, MI Turkish Board, and Turkish Association of Restorative Dentistry. She has a good level of English. She is married and has a son. The topic of her speech is Vital Tooth Bleaching, the Key to Success. Now the chair is yours, Dr. Celik. Thank you.
Thank you very much. Good afternoon, everybody. It's a great pleasure for me to make a presentation in this organization. And before starting my presentation, I would like to thank to Nice Bridge Academy for their kind invitation. Okay, today my topic is vital tooth bleaching, the key to success. But first, I think I have to share my screen share and yes. Also,
you need to click on share screen.
Yeah, on share screen. No, it's not. Can you see?
Yes, we can see. You can see. Yeah.
Okay.
Yeah. Okay, it's better.
Okay. Today our topic is vital tooth bleaching and the key to success. And the concept of looking better is gaining wider acceptance throughout the world. And in dentistry, to provide patients to look better is achieved by giving them better smile. There are different ways to make the smile better, but the most minimally invasive and cheapest way is to give them wider smile with tooth bleaching techniques. Okay. And yes, tooth bleaching process is an old technique. The tooth whitening process began around 4,000 years ago in the ancient Egyptian, and they used their whitening paste from ground cobblestone mixed in wine vinegar. White teeth symbolized wealth and beauty at that time, and ancient Romans used urine for whitening their teeth. People preferred barbers for the care of hair and their teeth during the 17th century. The barber would apply an acid for whitening. Yes, this acid whitened teeth, but also it eroded tooth enamel, so it was abundant. And the search for ideal agent for whitening of discolored teeth began in the 1800s. Oxalic acid, chlorine, and cyanide of potassium nitrate were first employed to remove stains caused by metallic restorations. And in 1884, the use of hydrogen peroxide was introduced by Dr. Harlan. In the 1900s, chlorine, superoxole, and sodium perborate were used for intracoronal bleaching, and in the late for vital teeth, first hydrogen peroxide was used in a solution form. In the late 1960s, a home bleaching technique was discovered by Dr. Bill Klusmuir, an orthodontist. He prescribed an oral antiseptic, glyoxide, containing 10% carbamide peroxide with a custom fitting tray. Yes, this gel was first described to improve gingival health, but the teeth were also widened, and in 1992, Dr. Haywood and Heyman described this technique as a night-guard white bleaching technique nearly 20 years later. Then over-the-counter products were put on the market in the United States. They include lower concentrations of hydrogen peroxide. And different light sources have been used to accelerate the whitening process. As in recent years, two important concepts have come to the fore in dentistry. The first one is minimally invasive dentistry. According to this concept, treatments are performed with minimal intervention to dental tissues. And during this period, the demand for bleaching treatments had gradually increased among the society because bleaching is the most minimally invasive method to improve the discolored teeth. The second is aesthetic dentistry. And unfortunately, the star of this concept is ceramic restorations. And don't forget this, it's very difficult to obtain ceramic white with bleaching. So the demand for bleaching has relatively decreased during this period. Yes, Brooke Shields was a well-known actress in Hollywood in 1960s, and she was the symbol of beauty at that time. But as you see, her teeth were white, but in natural shape and form. This smile was also acceptable at that time in even Hollywood. Aesthetic concept has first changed in Hollywood. Today, we come across ceramic restorations when we search for whiter smile in Hollywood. But nowadays, all we are well-known people thanks to the social media. And a wide and beautiful smile is very important for all of us. And we encounter ceramic restorations when we search the internet with keywords wider smiles. But we cannot achieve such white teeth with bleaching because we just lighten the shade of the tooth. We do not try to make any change in the structure or translucency of tooth with vital bleaching techniques. At the end, nowadays, all we want to have wider and brighter teeth because wider teeth is an indicator of youth, health, and physical attractiveness. But how we can widen the teeth?
Göndereceğiz inşallah. Gönderiyoruz abi. İnşallah. Seninkini gönderdik.
Okay, let's listen it. How the mechanism of the bleaching process.
As carbamide peroxide or hydrogen peroxide penetrate the enamel prisms in your teeth to get to discolored molecules in your dentin. Oxygen molecules from the bleaching agents break the carbon bonds of the discolored molecules. The oxygen molecules spread, whitening the entire tooth. As a result, you're left with a brighter, whiter smile.
Yes, first hydrogen peroxide and carbamide peroxide break down to the oxygen, then this oxygen break down the long chain chromogens to short chain molecules, and this leads to whiten the teeth. Yes, what's the difference between whitening and bleaching? Tooth whitening is any process that lightens the color of tooth. Whitening may be achieved by the physical removal of the stain or a chemical reaction to lighten the tooth color, but bleaching is the chemical degradation of the chromogens. And yes, There have been very important developments in the scientific field in recent years. On one hand, we're planning to go to the moon and then to Mars. We're planning to establish a new civilization on Mars, and numerous developments are also taking place in the field of nanotechnology, regeneration, and artificial intelligence. Then, what's the situation in bleaching? What changed from past to the present in bleaching therapy? In the other words, where we are. Today, we still use hydrogen peroxide or carbamide peroxide as a bleaching agent. The application modes are in office and at-home bleaching, and the light activation accelerates the bleaching process. And yes, initial tooth color is important, and it's hard to bleach dark shades. The well-known complication is tooth sensitivity in vital tooth bleaching still. And yes, there can be relapse within time in the bleaching results. And to the best of our knowledge, bleaching agents are safe when they are used under the supervision of dentists. And what are the indications and contraindications? All discolored teeth, light tetracycline staining, fluorosity without enamel loss, pink-brown porphyria discoloration are the basic indications, but also there are some contraindications. And excessive enamel loss, deep cracks and fractures, pregnant and lactating women, peroxide allergy, unrealistic expectations, and very large pulp chamber, temporomandibular joint disorder, dentin hypersensitivity, and smoking and use of tobacco products are contraindications of white tooth bleaching process. And we have to give attention to all bleaching steps, and the bleaching steps are first to make a realistic plan, to employ the right technique, to manage the complication, and to maintain the bleaching effect. First, we have to make a treatment plan, and during making this plan, we have to consider patient expectation, age, discoloration type, tooth evaluation, oral hygiene, smoking, and the type of technique. Yes, dreams and reality. Sometimes the expectation of the people significantly affect their satisfaction with the treatment. No matter how well we do the treatment in patients with very high expectations or those who want ceramic white, this may not satisfy the patient. Initial shade, enamel opacity, and thickness are very important when predicting the outcome. For example, in our first patient, the initial shade was light and the teeth were more translucent. But in the patient, in the second picture, the initial shade was darker and the teeth were more opaque. And in which the treatment results satisfied the patient more? The answer is in the second patient. Why? Because the initial shade was lighter in the first patient. In the first patient, the initial shade is lighter, and the teeth were more translucent, so the result was not very striking. But in the second patient, the teeth were more opaque, and also the initial shade was darker. So at the end, the teeth were perceived wider. And age is a factor affecting the treatment success. And as people are getting older, the enamel tissue becomes thinner and dentinal tubules become become occluded. So the bleaching process becomes difficult. In addition, the average age of the patient is approximately 30 in previous studies. And so we have limited knowledge on the bleaching efficacy of our current systems on elder people. However, in the near future, we will have more elderly patients who apply to our clinic for bleaching treatment. And what about patients younger than 18 years of age? In general, we do not recommend bleaching procedures for patients younger than 18 years of age because of the risk of patients not being able to cooperate adequately, and they can also have more tooth sensitivity. So we prefer to delay the treatment to older ages. But if the patient has severe pathological discoloration, then it may need to be treated before the age of 18. And what is the ideal age for tooth bleaching? According to my clinical experience, I think ideal age is between 25 to 35 years old. And coloring agents are very important also. The effect of coloring agents on treatment prognosis is very, very important. And the smoking is known as a contraindication for bleaching. However, too much discoloration may be observed in these patients. Yes, the ideal is to quit smoking, but this is not always possible for our patients. And so these situations has led researchers to search for alternative methods for smoking patients. In recent years, new research have been published on the prognosis of bleaching in smokers. And according to this research, tooth bleaching may be also successful in smokers, but they can need more follow-ups. They may need dental prophylaxis in these follow-ups compared to non-smokers. And the color relapse increases when the patients use coloring agents during or after bleaching. Yes, medications are really important, especially some medications and mouthwash. They can cause discoloration on the teeth. First, some patients can apply to our clinic with rapidly developing tooth discoloration. In this case, we have to question the patient in terms of medicines and mouthwash they used. And secondly, we should inform the patients to whom we apply bleaching therapy that these drugs and mouthwash can cause discoloration, so they have to avoid to use these drugs or medications during bleaching therapy. And tooth discoloration severity affects the bleaching efficacy. Both bleaching agents show better action on dark teeth than light teeth, I mean both in office and at home bleaching techniques. But the final shade was darker in dark teeth versus light teeth after the same bleaching period. So we have to apply the bleaching therapy probably longer to darker the teeth with darker shades. And yes, good oral examination is very important. Fractures, cracks, and wear should be evaluated before the treatment because this can cause tooth sensitivity, and deep wounds should be covered. For example, incisional surfaces should be covered in adhesion lesion with a bonding agent. In addition, the choice of bleaching agent and application time in the treatment should be planned according to these properties of teeth, because it increases the risk of tooth sensitivity. Oral hygiene is very important in many aspects, it affects the efficacy of the whitening process, and relapse is generally faster in patients with poor oral hygiene. As we are talking about success, what is success? First, we have to define the success in bleaching therapy. Yes, what are our goals? First, we want to reach B1 shade. However, it's not always possible in bleaching therapy. Yes, it's ideal to avoid all complications, but managing the complication is also an ideal result. Yes, and we have to try to protect the final shade as much as possible, and we have to make some suggestions to our patients to reduce relapse in color after the treatment. In the bleaching therapy, yes, we have to whiten the teeth, but also we have to try to eliminate the shade difference between central incisors and canines and the cervical and incisional area. The elimination of this difference will allow teeth to be perceived wider. Yes, the concept, which known as shade, consists of 3 dimensions: hue, value, and chrome. And in bleaching process, the hue may not change after the process. In other words, if the tooth is in A3 shade at the beginning, it cannot be bleached until B1 shade in each case and can remain in A1 shade in A series. The biggest change occurs in value and chrome in bleaching therapy. And sometimes, although too much widening is observed, the patient may not be satisfied with the results, such in this case. The reason for this is that the translucency of tooth does not change much during bleaching process, and the tooth preserves its natural structure, but its color widens just. In this patient, we got 7 to 10 shades improvement, but at the end of the treatment, the patient was not very satisfied. Yes, and how many visits should we apply the bleaching gel? Also, this is the commonly asked questions to us. Ideally, continue bleaching until you reach B1 shade. But we may not reach this color in each patient. In this case, another criterion is to continue bleaching under there's no difference between the 2 visits. Yeah, okay, then we want to continue to bleach the teeth. How many sessions can we apply the bleaching gel maximum? According to ADA, Council on Scientific Affairs, for at-home bleaching, 6 weeks applications have been reported in the literature. And also there are 3 to 6 months of applications in cases such as tetracycline. Application of 1 to 6 visits has been reported for the in-office systems, and generally very good results are obtained in an average of 3 visits. I think this is very important in bleaching therapy. The bleaching process should not be introduced as a single visit therapy, because this will increase patient expectations and will negatively affect the prognosis of the bleaching therapy, because we cannot get a good satisfactory results in each patient at just 1 visit. This is very, very important to balance the patient expectation. Yes, and also discoloration type is important because it's hard to bleach some discolorations like severe tetracycline and severe fluorosis cases, and also metallic discolorations. As bleaching techniques are divided into 4: professional techniques in office, in other words, and also under supervision of dentist bleaching, at-home bleaching, over-the-counter products, and non-dental techniques. and which one, in office or at home? Unfortunately, both have some advantages and disadvantages. And also the advantage of in-office bleaching applied by dentists protection of soft tissues faster than at-home technique. The advantage of at-home systems, low concentration gel, we apply low concentration gel, shorter treatment time in office, generally low tooth sensitivity is produced and low cost. The disadvantage of in-office bleaching, high cost, long treatment time in the office, high concentration gel, and high tooth sensitivity. And the disadvantage of at-home bleaching, the result depends on patient cooperation. It can disturb the taste also because it releases into mouth. Gel may release into the mouth, yes, gingival sensitivity and longer treatment time. Yes, the other alternative is a combined therapy. It includes one visit in office and 1 to 3 weeks at home bleaching. Yes. The active agents used in the office bleaching system are hydrogen peroxide and carbamide peroxide. But also there are some alternatives like non-peroxide gels in the dental market, but they're not commonly used materials. And which ingredients are important? Active agent, concentration, pH, activator, and desensitizers and remineralizants are important. Yes, activators generally determines the speed of bleaching, and in bleaching systems, chemical activators are generally used, but also heat, sometimes laser and high power lamps, low power lamps, and ultraviolet light are used as an activator. In office bleaching, we use high concentration or low concentration gels nowadays. High concentration gels include 30 to 40% hydrogen peroxide. They're effective systems, they're conventional systems, and generally all products have similar performance, but there can be difference between the different brands in terms of speed of bleaching process depending on the activators they use. And the other alternatives are low concentration gels, and they are relatively new products in dentistry. They include 6 to 25% hydrogen peroxide. But their effectiveness depends on their activator. And in the dental market, all low concentration products have different activators, and generally they're patented to this brand. So the products include the same concentration of hydrogen peroxide, may show completely different performance, and we could not predict it before use. In other words, we can predict their performance after we use it. Yes, is light activation required? Regardless of the light type, it was observed that the use of light source did not increase the whitening efficacy of low and high concentration gels. Generally, in this situation, I advise the operators to use light activation if the manufacturer claim them to mandatory use it. But if it's not mandatory, I advise the operator not to use it, because probably it would not have a beneficial effect on the bleaching process. And the states of in-office bleaching are oral examination, selection of bleaching agent, selection of technique, shade assessment, soft tissue protection, application of gel, number of visits, and recommendations to patient. Yes, before the shade assessment, the tooth surface should be clean. This is important. And the shade may be determined with a scale or with a dental spectrophotometer. In my clinic, I generally use dental spectrophotometer because to take an quantitative data. And initial dental photos should be taken. This is very important because generally patients forgot their initial shade. This is important for documentation. And you may use daylight, artificial daylight, or white balance mode during taking photos. Yes, the other stage is protection of the soft tissue. Yes, you have to protect your and also your patient's glasses. So you have to wear glasses. So you have to wear glasses. You have to use a cheek retractor and tongue retractor during bleaching system to protect the cheeks and tongue. And the surface of teeth should be clean before the application of gingival barrier, gingival dam. Generally, it's a light cured material. You have to check its tip first, and you have to apply it on gingiva next to the tooth. And also you have to overflow this gel of nearly 0.5 millimeter to cervical enamel. There shouldn't be any gap between the gingiva and tooth. After the application, you have to check it. Carefully and light cure it according to the manufacturer's instructions. And then check the stability of the gingival dam. But if you use light activation, in this situation, you have to cover all soft tissues because light activation generally produces heat during the treatment, and this heat can damage the soft tissues. And then the application of the gel. Yes, you have to carefully follow the manufacturer's instructions during mixing and during the application. And you have to control the resistance of the tip before the application. Apply the gel onto the buccal surface according to manufacturer instructions. And you have to wait for a while according to manufacturer's instructions. After the first cycle has finished, remove the gel from the tooth. If you're gonna apply a second cycle, in the situations, I generally do not wash the tooth surface if there's no sensitivity in the patient. But if there's sensitivity, a mild sensitivity, I wash the surface of teeth. Then I continue to apply fresh gel in second cycle. And in some cases, in office bleaching cases, yes, we used a high concentration gel in this patient and we get 3 to 7 shade improvements in 2 visits in this patient. Also, we applied a high concentration gel in this patient. We get 3 to 10 shade improvements in 3 visits in this patient. Yes, in this patient, we first bleach the upper arch. You can see the difference between the bleached and unbleached teeth. And also we use the low concentration gel in these patients. We get 7 to 10 shades improvements in 3 visits. And another low concentration gel case, we get 4 to 8 shade improvement in 2 visits in this patient. Also, this is another case. We get 3 to 10 shade improvements in this patient in 2 visits. In each visit, we applied the gel according to manufacturer instructions, 20 minutes, but we applied 3 cycles in this patient in each visit. And another case, we get 3 to 10 shade improvements in 2 visits. And in this patient, we get 7 to 10 shade improvements in 2 visits. As you see, we applied the bleaching system generally at least 2 visits, especially to get good results in canines. According to my clinical experience, I can get these results. If the initial shade is A2 in the patient, then 1 visit is enough to get A1 or B1 shade at the end of the bleaching process. If the initial shade is A3, then generally 1 to 2 visits are needed to achieve to get A1 or B1 shade. If the initial shade is darker than A3, then 2 to 3 visits are needed to reach A1 or B1 shade. And the other technique is at-home bleaching technique. Treatment stages are similar: oral examination, selection of bleaching agent, preparation of tray. In this patient, we have to prepare a tray for bleaching, and the application of gel, number of visits, and recommendation to patient. As we have to take shade with a dental spectrophotometer or with a scale, then take initial photos. We have to prepare custom fit trays in these systems. We have to first take impressions and get a case model. Then we prepare reservoirs with the block-out material. I prefer generally scallop design in my trays. The patients should place the gel in the reservoirs, into the reservoirs in this method. We generally prefer the trays in 1 millimeter thickness, but if there is a bruxism in the patient, then the operator may prefer 1.45 millimeter trays. First, we get an impression from the patient, then prepare a case model. You have to trim the model. The model should be parallel to the floor. And then the operator should apply block-out material onto the buccal surface of teeth in 0.5 millimeter thickness. Yes. Light cure the block-out material according to manufacturer's instructions. Remove the oxygen inhibition layer, and then we're gonna apply the tray onto the model with a vacuum device. After it cools, remove it and remove the excessive parts. After you prepare the tray, you have to check it on the model. There shouldn't be any gap between the tray and model. If there's a gap, you have to adapt it with a flame and water. There shouldn't be any gap. This is very critical issue. Yeah. Then you have to show the patient how to use the bleaching agent, how to apply the bleaching agent into the tray. It is beneficial for your patients to try it with the operator. And the excessive gel should be removed with a toothbrush. Then, after the bleaching process, the patient should brush their teeth and should wash the tray with a toothbrush. We use 10 to 22% carbamide peroxide or 3 to 10% hydrogen peroxide as in the at-home bleaching. And when we use these systems for 2 weeks, generally we get 3 shade improvements in light shades, we get 6 shade improvements in medium dark shades, and we get 9 shades improvements in dark shades. And when the initial shade of the tooth is darker than A3, generally more than 2 weeks are required for at-home bleaching technique. And which one, at-home bleaching or in-office bleaching, is according to my clinical experience. If there are tooth cracks on the tooth, I generally prefer at-home bleaching in these cases. If the patient has shorter time for bleaching process, I generally prefer in-office or combined therapy. If the patient has less time for in-office treatment, then I prefer at-home bleaching or combined therapy in this patient. And translucent enamel syncretic dentin, in this situation, I prefer at-home bleaching or combined therapy. And in severe discoloration cases, I generally prefer combined therapy. Yes, this is a case I applied combined therapy in this case, 1 visit at home in office bleaching and 2 weeks at home bleaching. And we got 10 to 12 shade improvements in this bleaching. I generally love to apply a combined therapy in bleaching process. And the other technique is microabrasion. In microabrasion technique, we use generally paste containing hydrochloric acid to abrade the subsurface porosities together with stains that cause discoloration. And we use this technique generally in hypomineralization lesions like fluorosis case. And the other technique is at-home bleaching technique, but over-the-counter products. They are cheap, easily available, and can be applied in a short time. They are uncontrolled use, but they have some disadvantages. Their uncontrolled use creates sensitivity and gingival damage, and the desired whiteness may not be achieved when the patients are used these systems. These systems sometimes cannot satisfy the patient. Yes, we can get nearly 2 to 4 shades improvements with over-the-counter products. So we generally advise our patients to use them in light-colored teeth, and also we can use these over-the-counter products in combined therapy with in-office bleaching technique and in the maintenance treatments. And some at-home bleaching cases. In this patient, we use 10% carbamide peroxide for 2 weeks, and we get 8 to 10 shade improvements. And another case, apply 10% carbamide peroxide for 2 weeks, we get 7 to 8 shade improvements in this case. This is an over-the-counter product case. We used an over-the-counter product for 10 days, and we just get 4 shade improvements in this patient. And this is a fluorosis case. We used microabrasion with in-office systems. In office bleaching, we get very acceptable results for the patients. And this is another dental fluorosis case. We used microabrasion technique with at-home bleaching technique for 3 weeks, and we get very good results in this patient also. Yes, when we're making a treatment plan for our patients, we have to consider this principle. Generally, 1 visit in office treatment equals to 1 week at home bleaching application, and also it equals to 16 days over the counter products application. And yeah, there are some also, we can encounter some problems during bleaching process. What are they? Tooth sensitivity, gingival irritation, and color relapse are mainly encountered problems during bleaching. And tooth sensitivity is an important, I think, complication, is a commonly encountered complication. It occurs because peroxide can reach to the dentin and pulp, and it can produce reversible damage in the pulp. And generally, higher risk exists for higher peroxide concentrations, unfortunately. And what can we do for this problem? First, we have to prevent tooth sensitivity. Prevention is important. We have to make a good oral examination and cover the exposed dental surfaces. This is very important. Also, the other alternatives are to use of desensitizing toothpaste 2 weeks before bleaching, and use of desensitizers nearly 30 minutes before bleaching. Generally, these desensitizers include potassium nitrate. But if the hypersensitivity occurred after bleaching, then what can we do? We can apply potassium nitrate, fluoride, casein phospholipid, laser, or painkillers to our patient. We can prescribe painkillers. But don't forget this. All these techniques cannot eliminate all hypersensitivity. They can just reduce the hypersensitivity. Generally, hypersensitivity heals within time by itself. And the other alternatives, interrupting treatment for a while, re-examine the patient, and also solve the problems in the patient that causes tooth sensitivity, changing the treatment protocol, and if the sensitivity is very severe, anesthetize the patient also. Teeth should be brushed with warm water and a soft brush to prevent the hypersensitivity. Very hot and cold food and drinks should be avoided during treatment. And also bleaching agents should not be used longer than recommendations to prevent the tooth hypersensitivity. Yes, relapse. That can be relapse in bleaching result. Relapse in color after 1 to 2 weeks after the bleaching application can be seen. It's normal. It's due to rehydration and also remineralization. But also within time, due to use of coloring agents, relapse can be occurred after the bleaching treatment. Generally, we advise operators to polish the teeth and to prescribe their patients remineralizing agents at least for 1 month after the bleaching to prevent the color relapse in earlier times. But there can be relapse within 2 to 4 years, and in this situation, generally 1 to 2 days at home or 1 visit in office application can be enough to get good results. And also, over-the-counter products can be used in this situation. And what is the feature of bleaching? Yes, in the future, probably we're gonna use artificial intelligence also for bleaching process. In the other words, the bleaching process will be more individualized. Yes, this is a new device. This automatizes the process. Yes, the trays are specific for the patient, but we can easily prepare it. And the gels are automated, mixed. And are heated by the device. And we use freshly prepared gels. And gel exposure to all teeth surfaces. With the help of patented soft tissue isolation, we can arrange the concentration and duration. Probably we're gonna get good results in one visit. It can be applied by hygienists. Yes, as a conclusion, I think in an operative manner, bleaching therapy is relatively easy method, but to manage the treatment is very important to get successful results in bleaching therapy. The operator should make a proper indication. To balance the patient expectation is very important, and to select proper technique and also material is critical in bleaching process. Attention should be paid to the details and technique. The operator should know the end point and should manage the complications. Also, suggestions should be made for maintenance. After all, we can get very good results in bleaching therapy. Yes, by this way, I've finished my presentation. Thank you very much for your attention.
Thank you. Thank you for your presentation, Dr. Uzer Celik.
Thank you.
Thank you for your nice presentation, as usual. Any question to Professor Esra? Uzer Celik?
Yes,
there are a few questions in the chat box, but
Chat box, some
yeah,
questions.
but they are about orthodontics, so which is the previous presentation. So I think your questions will be with the next session.
I think there's a question. I can see a question about whitening process, lasers. Okay.
Mikrofonunuz kapalı olabilir mi?
Yeah.
Can you hear me?
Yes, we can hear you now.
Okay, okay. I saw a question about whitening in the chat. What do you think whitening with diode laser? I think, do you advise it? Yeah. Okay, then I can answer it. Yes, lasers also are used for tooth whitening. I think, yeah, to apply the gel with laser, yes, has some advantage, but it may increases the speed of the treatment. But I think the final success will be equal to apply it with or without laser. It may just increase the treatment periods. It may speed the bleaching treatment. I generally use, I don't use light activation in my clinic because they also have some disadvantages. They, yes, produce very good results immediately at the end of the treatment because of also rehydration, because heat produces during light activation and this causes rehydration on tooth surface. But after generally 2 weeks, there can be a evident relapse when you use light activation. So in my clinic, generally, I don't use light activation, but you can use also. It's up to you. But I think it doesn't have very beneficial effect on the bleaching efficacy. Sesim geliyor mu?
Yes, we can hear you.
Okay. Can you hear me? Okay.
Thank you for your presentation, Dr. Celik.
Okay. Also, I again would like to thank to you for your kind invitation.
Thank
It's
you.
a great pleasure for me to be here. Thank you.
It is our pleasure. Thank you.